Hello, everybody. Thank you for connecting to this website to watch this webinar, my presentation about the decontamination of personal protective equipment, and then especially the filtering face piece respirators. First of all, I would like to thank the SIU and Professor De La Rosette for allowing me to talk to you. So my name is Harry Ousoren. I'm an expert in sterile medical devices in the Amsterdam University Hospital in the Netherlands, and I'm also the secretary and an EC member of the World Federation of Hospital Sterilization Sciences. But now let's go to the more important part, the decontamination of the filtering face piece respirators. My talk is about the decontamination of single-use filtering face piece respirators. In the United States, it's called the N95 masks, and in the south of China, it's called the KN95 mask. And we are talking about these kind of masks during the COVID-19 or corona pandemic. When you look at the masks, there are two different kinds of masks. We have the filtering face piece respirators, and we have the surgical mask, or sometimes people call this the surgical mouth and nose mask. This last category is not included in this presentation. I'm only going to talk about the first category. So when you talk about this filtering face piece respirators, they are divided in three different types: the FFP1, FFP2, and FFP3. And FFP stands for filtering face piece particles. And depending on the number at the back of this FFP, it tells you something about the number of filtering of the percentage of the particles. So as you can see on the screen, it's 80, 94, or 99%. And when you look at the FDA, the N95 masks are equivalent to the FFP2 masks in the Netherlands. So what is about these masks? These masks are all single use, and these masks must meet the CE mark, which is a quality mark in Europe, and in the United States it has to be FDA approved. So only we use these single use. If you have asked me in the month of January, are you going to reprocess these single use items, I would have said no. But now we have this coronavirus. So everything changes in the world, and we have to think forward for that. So what is one of the problems? The supply is stagnating. And that is, while the use increases, the supply stagnates. So that means that the demand transcends the supply, and that is a big threat of shortage. So if you are going to be confronted with this, you have to think about what are we going to do if. So then we thought about some principles here in the Netherlands. So the first principle is better to have something than to have nothing. But if you are going to supply somebody with something, it must be as safe as possible. And then they asked us, rate decontamination of these masks as an option. So check if this can be an option in your hospital to do. So we had a Dutch inspectorate, which is a very strict inspectorate, and they said, okay, during this COVID pandemic, we understand that you sometimes are going to be confronted with a problem. So don't ask it to us, solve your problem, but make sure that you have documented it very well. So after everything has been done, you can be accountable for all your actions. So you have to be sure that you can explain why you did it based on what research, on what norms, etc., etc. So the second principle is reprocessed masks are only allowed to be used if the new ones are not available anymore. So that means that every mask that you had must be new, and if all the new ones are out, then you can use it. But I will come back to that later. So when we are talking about decontamination of these masks, I will tell you up front, I'm talking about decontamination. And in my presentation, I will use the word sterilization. So that can be a little bit confusing. So when I'm talking about sterilization of surgical instruments, we talk about cleaning, disinfection, and sterilization. All three of them together, these are the items that make it a sterile supply. But in this case, we are only going to use the sterilization method, so no cleaning, no disinfection. So that's why we call it decontamination. So when we look at the European guidelines, which are applicable for these masks, you can see all the on the screen. You can see all the applicable guidelines, but especially the last one, it tells you something about testing methods. So it's supposed to be determining the penetration of the filters in the masks. So when you look at that, there should be done 3 tests: a penetration test. And in this test, you use saline and you use paraffin. You need to do the exposure test in continuation of this penetration test. And you need to do the storage tests. One thing, these tests are not available in hospitals. They are only available in certified centers. So we don't have them, so we have to improvise and search for reliable and reproducible methods how we are going to reprocess our masks. So what we did together with the Technical University of Delft, we developed a device. And you can see that device here. This is what we developed. And actually, it's not very intelligent to develop. What you will do, you will put on a particle counter, and you connect it with this device, and you suck air via through the particle counter, and you suck it through this opening. And you count your particles. After you've done that, you know how many particles are in the air. The next step that you do, you will put your face filtering mask over this hole, you slut it off, and then you do the same type test again, and then you check how many particles are coming through this filter. And then you can decide what is the percentage of particles that came through your filters. So, but we thought this was not good enough, so we hired a more professional counter, and you see this on these pictures. And there you can also see that we count on the 0.3 mu, 0.5, 1.0, 3.0, 5.0, and 10.0. Actually, the last ones we don't even count. Most important are the 0.3 and the 0.5 mu, which says something about the size of the particles that we measure. So the next thing that you do is you have to do a fit test. So for these fit tests, there are 3 different options. The first option is the simplest one. Put your mask on, feel if it's okay, test if it's okay, and if you can breathe through it and you don't feel any air leakage on the sides, it should be okay. So the next one is what our research center in the Netherlands uses, and it looks a little bit like on the picture on the side where somebody drinks coffee through it. You drill a hole, you put in a hose, and you measure the number of particles in front of the mask and on the inside of the mask